Aloha, and welcome to this presentation of the Vegan Society of Hawaii. We've been promoting human health, animal rights, and protection of the environment by means of whole food, plant-based vegan education since 1990. We're delighted and honored to welcome today as our special guest, Kim A. Williams, MD, MACC, FAHA, MASNC, and FESC. Dr. Kim Allen Williams is currently the chairman of the University of Louisville Department of Medicine. He specializes in cardiology, cardionutrition, cardiorheumatology, cardionephrology, preventive cardiology, and cardiovascular radiology. He is a past president of the American College of Cardiology. Dr. Williams has over 40 years of experience as an educator, researcher, and clinician. It is with distinct pleasure. Welcome. Aloha, Dr. Williams.
My topic today is dueling the dual pandemic, and it really has to do with the fact that we are in a difficult situation that really is confounding when you look at it, that it's a situation that never should have occurred, because if we had all done all of the evangelism, if you want to call it that, health-wise, for healthier lifestyles, the pandemic of COVID-19 would never have gotten that far. And I'm going to say that provocatively and then prove it to you through the literature. All right, so let's talk about nutrition, though, because it underpins the risk factors that I'm going to talk to you about. And even though I, as a cardiologist, over 40 years, I would have thought tobacco, blood pressure, maybe diabetes were the top 3 causes of poor health. But it turns out it's really dietary risk that's underpinning everything. And if you look very carefully at what the result of our nutrition practices are in the United States, it's really overwhelmingly difficult to imagine what's going to happen in the near future if people, one in every 2 people has diabetes or pre-diabetes, 3 in 4 are overweight or obese. And the amount of metabolically healthy people is really about 10%. Now, it's just as bad when we talk about our young people. The number of people who are military ready. Maybe all the future American conflicts will be fought by drones and people playing video games with life and death consequences. That is possible, but if it's going to come down to the kind of military exercises that we've been able to do in the past, the data shows that we're not ready anymore, and it really does have to do with lifestyle and nutrition. Step away from the human factors and just talk about the economic costs, because this affects us all. If you just drop down to the bottom, there's a lot of facts on here, but if you just back down to the bottom and say $160 billion spent on diabetes alone, this is something that, roads, bridges, infrastructure, free education for people and their children growing up in poverty. There's so many things you could do with $160 billion that would make our country stronger. But instead, we're actually spending it on really an unnecessary disease, something that it is a choice of people in their lifestyle. Throw on top of that the fact that cardiovascular disease has been a leader of cause of death in the United States since 1918. It wasn't taken out by COVID-19 in 2020, and it remains cardiovascular disease remains number 1. But then you put another blood vessel inflammatory disease on top of what we were already experiencing, and surprisingly, it's the same issues. The diabetes, obesity, and hypertension are the kinds of things that result in worsening outcome of, does everybody remember when coronavirus was one of those cold viruses that you got it for 2 or 3 days, it was annoying, and then it was gone? Well, it's mutated. And now we're at the point where the cardiovascular risk factors and the bad outcome risk factors from COVID-19 are essentially the same. The obesity, diabetes, hypertension, hyperlipidemia, those are the ones that I want to talk about. Obviously, there are others such as, lack of exercise and smoking. But I'm going to spend most of my time talking about our problems here in the United States, but I don't want to pretend that this is the only area where we have this sort of issue. I mean, we actually have a substantial number of people around the world who are suffering similarly from dietary insufficiency, let's call it, dietary excess, not enough whole grains, not enough fruits and vegetables, too much sodium. And the fact of the matter is that the publications will tell you 11 million deaths and 255 million disability adjusted life years result from the food choices that people make. Now, I do want to distinguish the United States again, though, as being one of the worst developed countries in terms of life expectancy. And it really does relate to our particular lifestyle habits. And so, and then you pile on top of it what people have characterized as a toxic healthcare financing system, so that everything here is extremely high quality, but extremely expensive. And so what we're paying for and what we're getting look horrible on a graph like this one. Now, what could we do about some of these risk factors? That's I'm going to spend most of my time talking about the underpinning causes, both for COVID-19 and cardiovascular bad outcomes. And I would say it's the lack of people understanding the importance of a vegetarian diet, even though your organization and so many around the country have been talking about this for almost a generation. It just hasn't taken on, and for a lot of the reasons that I'm going to discuss. But there's no question, if you start looking at these risk factors individually, such as this one, looking at blood pressure, you're going to see dramatic improvements in blood pressure if people would do a plant-based diet. If you look at a randomized trial, such as the very famed DASH trial, Dietary Approaches to Stop Hypertension, Johns Hopkins, what did they show? Yeah, the more fruits and vegetables you do, the more plant-based you are, the better your blood pressure control is going to be, or that drop with the dietary intervention. How about cholesterol? This is another review by Neil Barnard's group, taking it at the massive literature, and it's very clear. Every time you do take an omnivore and change them into even strange forms of plant-based diet, lacto-ovo, even pesco-vegetarian, you're going to see an improvement in the cholesterol. And they can be extremely dramatic, depends on the population and how much fiber is in that plant-based diet, but you're going to see some dramatic improvements that could actually reduce someone to the point where if they have risk but not disease, they may not need medications for either the blood pressure or the cholesterol. We have good data on inflammation as well, and I don't want to mention too much about cholesterol without talking about that C-reactive protein, a measure of inflammation that really is very clearly associated with heart attack, stroke, and death. And the two of them together really do put people at high risk for blood vessel and bad major adverse cardiovascular events. And so guess what? You have a couple of procedures that should be commonplace in cardiology. One is statins, which are widely accepted and widely utilized, and the other one is a plant-based diet. This particular one, in Journal of American Medical Association, almost 20 years ago, David Jenkins, University of Toronto, talking about putting a lot of fiber and plant sterols with black bean soup and the like, and you put those into a diet 3 times a day, and you end up with a drop in your LDL cholesterol and your C-reactive protein that is comparable to what you could get using medication. This has been reproduced. This is data from Benita Shah, the EVADE-CAD trial, which did an intervention for 8 weeks with either the American Heart Association diet at the time. This was actually done in 2018 before the new American Heart Association guidelines come out, which I'm going to talk about in a bit. And it turns out that if you look at the cholesterol, if you look at the inflammation, you really do see a significant improvement in the vegan diet group and not so much in the American Heart Association diet. Now, I've talked a little bit about hypertension and hyperlipidemia, but I really need to talk a little bit more about what's underpinning all of that. And that is, it's the microbiome. That is, just to give you a little background, since many of you are not even familiar with what is this cardiologist talking about. Well, it turns out that more than half of your body is actually not made up of human cells. And we're only about 43% of the body's total cell count. If you decide, forget the cells, just do DNA pairs, then really it's about 1 out of 1,000 of our genes is actually human. What is the rest of it? It's bacteria, fungus, one-celled um, microscopic beings and viruses. And that so-called microbiome, I'm going to confine most of my comments to the GI tract. You know, we do have a microbiome that is bacteria that are in our scalp and in our ear canals and around our teeth. There's a microbiome pretty much everywhere, and some are more, difficult than others. But the one in the GI tract can be good or it can be bad. It can help you with food digestion. It can help you with risk factors. It can help you with in immunity and how you fight off infections, or it can make things worse. And so a harmful or so-called dysbiotic microbiome promotes diseases. And it's not just cardiac, it's neurologic as well, as you can see on this slide. And we're seeing more and more evidence directed toward trying to change the microbiome to try to improve human health. That includes actual prebiotics, which would be a whole food plant-based diet that has a lot of fiber in it, because it makes the bacteria select themselves to be the good kind and the bad ones go away. But when you eat the carcass of a deceased animal, you end up with a microbiome that's full of bacteria that you don't really want to have in your GI tract. And I know there are people out there promoting probiotics. To my understanding of the literature, that's sort of ahead of the peer-reviewed evidence. That is, they're selling them, but they don't have the evidence that they're all that helpful yet. Looking forward to that evidence, because it makes sense if you can find a way to sustainably change the microbiome to the kinds of bacteria which will be helpful to the GI tract, and therefore your inflammatory system and your immune system, then we're going to be much better off. So how does it relate to the risk factors that I'm mentioning? Well, it turns out that for hypertension, there's a lot of data, and it's increasing all the time, that the gut microbiome actually determines what your blood pressure is going to be. And there are sure other genetic and environmental and hormonal factors, inflammatory forces, but how you deal with short chain fatty acids, how many anti-inflammatory immune cells you have, though they can actually determine whether or not your blood pressure is going to be low enough. You will actually have, if you have a wide variety of bacteria, so-called alpha diversity, you have a lower blood pressure. If you have more gram negatives, these bacteria that you see listed, including Klebsiella, some that you may have heard of before, they are actually associated with with higher blood pressures. The data is actually very clear that we need to spend more time probably measuring the microbiome in people with hypertension and other risk factors, as has been done in some of these studies, finding out that the particular species that will increase your butyrate levels, would decrease your GPR43 signaling. These can actually help your blood pressure or hurt your blood pressure. How about cholesterol? Most of us just think, that cholesterol comes from two sources. That's the classic teaching. What you eat, which hopefully is none, because if you're doing a plant-based diet, you're not ingesting cholesterol at any significant amount. And but your cholesterol is being made in your liver. All of that gets excreted into the biliary tree, goes into your GI tract, where it has to be really mixed and absorbed. Okay, well, suppose you had something going on in your GI tract that would break down the cholesterol into something else. And that's any bacteria that has the ISMA gene. It changes the cholesterol into caprostanol, which ends up going out in the stool. And so what you really would like to see is a variety of bacteria that have that ISMA gene. And if your cholesterol is elevated, you can actually make a huge difference just by changing the bacteria in the GI tract. And so I'm hoping that down the road, we won't just have medications to block absorption of cholesterol, and we won't be stuck with just the dietary interventions alone, but having a wonderful microbiome can destroy some of that cholesterol and keep it from ending up in our arteries. How about diabetes? This is a really rapidly growing area where we know that people, because of what they eat, they end up with a microbiome that's so-called dysmetabolic, and you will end up with doing all the wrong things with the food that you eat, hyperabsorbing, which then gives you a higher insulin level, which then makes all nutrients go into all cells, particularly fat into fat cells. And so what you end up with is more bacteria, more weight for the same amount of food that you eat. And that really does depend on what's going on. So again, there's some gram-negative bacteria that actually are positively associated with type 2 diabetes. And there are those that when you have them in your GI tract, they can block the development of diabetes. So you're going to see much more data on that. And I expect that hopefully every clinic that deals with diabetes, hypertension, high cholesterol will start to actually measure the microbiome and make prescriptions, particularly of plant-based diet, and maybe probiotics based on the existence of good or bad species in the GI tract, because the data is very clear. Look at this looks like a really complex. This is actually not that complex. You have the blue ones are bacteria that have been found, bacteria species that are associated with getting rid of diabetes or controlling it. And the red ones are those that make it worse. Same thing here. But this particular work not just characterized the different bacteria, but what exactly are they doing? Are they changing how the blood sugar and the insulin work together? Does it increase the amount of food that's absorbed across the bowel wall by changing the gut characteristic? Is it causing inflammation, which we'll get back to because that's so important for COVID-19? For obesity, a similar story, that you have a fast-growing literature talking about how much are you able to absorb? That's what your GI tract is supposed to do. And if you can limit the absorption, which you can do with some drugs, then the calories can go in, but they end up in the stool and people do not gain as much weight. And so, but more than that, more than just absorption, it's how the bacteria break down foods. And so more short chain fatty acids are good for your blood pressure, as I mentioned, that you can actually change someone's weight by changing the bacteria in their GI tract. And actually bariatric surgery has a similar effect, changing the species that are in the GI tract. Ultimately, you want to have less fat storage. Unless you are extremely thin, then maybe it's going to be helpful to you. But for most of our American population suffering from overweight and diabetes, the fasting-induced adipose factor really does increase the amount of fat storage. And these are things that we can fight with the right microbiome. I want to switch over and talk about a particular aspect of the microbiome, and that is the TMAO. You may have heard this before, and hopefully every vegan medical lecture includes something about this compound, trimethylamine N oxide, because it's been out now for New England Journal of Medicine 2013, where you eat animal products, they go into your GI tract and get absorbed. Get converted into trimethylamine. Now, that trimethylamine then gets oxidized by the liver into trimethylamine N oxide, which is associated with heart attack, stroke, and death. That's what they said in 2013. Then they realized it's a lot more complicated than that. And you end up with more brain issues, kidney issues, blood vessel issues. And ultimately, it's something that we could intervene on by getting rid of the amount of red meat that people are doing. It's red meat more than white meat, and certainly not at all from plant-based meat. And if you make that change in what the amount of red meat that you're eating, you can decrease your plasma trimethylamine N oxide. And so I have wonderful interventions here, non-meat, red meat, white meat, going back and forth, watching the TMAO levels, or TMA levels go up and down. And yes, there are some people who metabolize trimethylamine very slowly, and so they're going to get less issues with the cardiovascular system. But most normal people, if you produce this compound, it's going to end up oxidized and hurting our blood vessel system. People will say that there's a problem with this data because fish has trimethylamine and oxide, and fish is good for you. Well, I would challenge that last statement. It may be better than red meat, and probably because not every fish is a fatty fish that uses or cold water fish that uses TMAO for antifreeze. And so the idea that fish is better, it really is substitutionally better than red meat, but not better than eating a plant-based diet. That correlation with TMAO with disease states really needs to be expanded on. And I would say that we have very clear evidence that one of the reasons that it's so bad on our blood vessels and major adverse cardiac events is the fact that it makes the platelets, that's the clotting elements in the bloodstream, it makes them sticky. And that stickiness, everybody knows you can try to make it better by taking aspirin if you have blood vessel disease. We used to give it for prevention. Now we know better because it does cause bleeding, of course. And so it turns out that a person with a low TMAO level, shown here on the right, is going to have the platelet aggregation of someone who is a meat eater who is taking aspirin. And so we could actually do sort of aspirin naturally simply by doing a whole food plant-based diet. The data on heart attack, stroke, and death is actually very convincing that if the more TMAO you have in your system, the more likely you're to have a bad event. And then the heart failure data came out a couple of years later saying that it does not clear that it's causative, but it's certainly associated. And that makes a lot of sense because we've known that red meat causes TMAO, and red meat is associated with more heart failure. Red meat is not just heart failure, it's heart attack, stroke, death, cancer, and red meat kills, and processed red meat kills faster, and it is dose related. And we always want to try to make it 0 servings per day based on all of the data that we've seen out of the Harvard group, the Nurses' Health Study. There's a unique relationship between meat consumption and development of coronary heart disease. And it may seem like it's small, but that's not really that small when you're in clinical practice. If you're looking at interventions that could take away 18% of your heart attack victims, and that's basically what this is saying, get away from processed red meat. That would be a big help. Not going to eliminate it, the disease, but it's going to lessen it. And so we have lots of data like this. This is the Harvard group saying basically the same thing, but also projecting that by their data, by their food frequency questionnaires, just about anything you do, in this case, other than fish, really, will make a lower coronary heart disease rate than doing red meat. But the best would be soy, nuts, plant-based protein. This data for heart failure, not just the so-called ischemic heart disease or coronary heart disease or heart attacks, as people would know it in the lay population. Heart failure, where people have worsening function of the heart and get particularly short of breath and legs are swelling and high risk of death. You can put in a defibrillator, but the mortality rate is still extremely high, taking a lot of medications. Well, it turns out that one of the best things you could do to avoid it is to avoid red meat, both processed and unprocessed. But that processed red meat, 243% increase. That is what this data is showing. So this is something that all of our heart failure patients should be avoiding. And I don't see a lot of our heart failure clinics saying, hey, you've got heart failure, you need to go vegan. But the data is actually pretty clear. In the Kyla Lara study from regards to their analysis, if you did a plant-based dietary pattern, you were going to have a 41% lower risk of heart failure, regardless of what else was going on. We have to do a little bit of a talk about eggs because I talked about red meat, and the fact of the matter is red meat is actually safer as long as it's not processed. It's a little safer than eggs. Why is that? It's the cholesterol, no doubt. There's a linear relationship between the amount of egg consumption and the amount of mortality. And so most of it is cardiovascular disease, but overall mortality, all-cause mortality, goes up substantially as you eat more and more eggs. It's true in the United States. It's true in and the data is actually very clear, but it wasn't just hypertension and high cholesterol. It was cancer mortality in their study as well. And so eggs should be minimized or eliminated. There was a third study that people should know about. It was a Chinese analysis of our National Institute of Health data that showed exactly the same thing. The more you eat, the more mortality you're going to result in. And so more cholesterol, more egg consumption associated with a higher cardiovascular death rate. So we've talked about processed meat, eggs, and red meat that's unprocessed, but I really want to make the point even finer that there really aren't any safe animal products for human consumption. This is the data from the Walter Willits group at Harvard, health professionals. So those of you who are doctors and nurses, this actually applies to you if you have any cardiovascular risk. And that is, and I'm going to just blow this part up a little bit, that every one of these reaches statistical significance, meaning that there's a real verifiable effect if you just replace your poultry or your fish with only 3% substitution with vegetable protein would actually stop you from dying. About 0.94, that's a 6% decrease, okay? And so, yes, it's true for every animal product. Some are safer than others. Fish and poultry safer than dairy, dairy safer than red meat safer than eggs, and eggs safer than processed red meat. It's cardiovascular, but it's also overall mortality. And people will challenge this and say, oh, doctors and nurses don't know how to fill out a food frequency questionnaire. But, that kind of criticism, you have to take that with a grain of salt because if you have bad questionnaires, that makes it less likely that you're going to find a true relationship, not one that is very solid like these are. So, but anyway, in response to the criticism, other people started looking at their databases, and guess what? Same journal, 3 years later, publishing really the same results. This one's from Japan. There are no safe animal products in terms of all-cause death, cancer death, cardiovascular death. And then it was published a third time. This is another large group, 416,000 men and women, the National Institute of Health, AARP, Diet and Health Study, very clear that avoidance of animal products, just 3% change from animal protein to vegetable protein, really does decrease your death rate. And not everything reached statistical significance, like infection and the like, respiratory diseases, but stroke, heart disease, cardiovascular disease, overall mortality, they all improve substantially. Red meat, you have to throw in the cancer. That one met statistical significance as well. For egg protein, pretty much everything you did other than infection reached statistical significance. And so we've learned a lot from all of the existing studies, and unfortunately, most of it is ignored. And we continue to market, and our dietitians are still talking about using animal protein as high quality protein. So I will challenge that as I go forward. But one of the biggest challenges to plant-based nutrition came from the Predimed trial I'm showing you here from the New England Journal of Medicine a few years ago, where they said that if you look in the upper left-hand corner, there was a 30% reduction of heart attack, stroke, and death if you changed from red meat to fish and a little poultry with the Mediterranean style, that it was either split into extra virgin olive oil or a lot of nuts. Well, it turns out that 30% reduction was not decreased dying. And that was very clear from the manuscript, but people were taking off and running with it anyway. And so if you look at the data to the right, it gives you all the details you'd want to know. who in which group, extra virgin olive oil, nuts, or the red meat instead of fish, it turns out that the stroke reduction was really dramatic. And that's what drove the 30% reduction. Heart attack rates were about the same. Death from cardiovascular causes, about the same. Death from any cause, about the same. And so if your only goal, and I'm not so sure it's not a laudable goal, but it shouldn't be the only goal. But if it's to avoid stroke, that's what you're doing when you tell a patient to avoid red meat and go with fish. Now, they did kindly reanalyze their data in terms of plants, how vegetarian were people in their diet, in their diet study. And it turns out that if they divide the people into 5 quintiles, the top 2 quintiles, that is the most vegetarian people in the study, had like a 42% decrease in mortality. So I think that's the main message from the PREDIMED trials. Very well done, very disappointing in terms of fish saving lives, only saving stroke. But the clear message is you really should be doing a vegetarian diet. I do want to throw in some comments before stopping about cardiorenal disease, and that is the fact that we have a lot of overlap between the things that cause heart disease and stroke and chronic kidney disease, including the TMAO, and the fact that there's a large amount of burgeoning data indicating that if we changed from animal protein to vegetable protein, we're going to save a massive number of kidneys. The data is very clear, inverse association between plant and protein and the incidence and progression of chronic kidney disease. Red meat puts people on dialysis if they are at risk, and everyone should be avoiding it. Instead, we have our dietitians in the nephrology groups telling people that they need to eat more red meat. That's may help their business model. It's not helping the patients. And I'm not saying that, insulting. I think it's our job to educate them as to what the literature actually says. So it turns out that it's TMAO. When you're eating red meat, you end up with more trimethylamine N oxide, and that actually increases the amount of kidney disease and the death rate in kidney disease patients. And that elevated TMAO level, 2.8-fold increase in mortality if you have the CKD. What is that talking about? It's really the same thing. That is, the CKD is caused by red meat, and the TMAO is associated with red meat consumption. And so you're going to see a correlation between the two. And if you can get that TMAO level down, you will see a better long-term prognosis. Okay, so is this like vegan propaganda 101? No, this is the National Kidney Foundation talking about what people should be doing to protect their kidneys. And the answer is a plant-based diet for everyone who has chronic kidney disease. They're basing that on solid evidence that from the peer-reviewed literature that animal protein having high biological value, which is not true. It produces a lot of acid, which is toxic to kidneys. Plants are the only source of fiber. The plant-based oils, such as olive oil, are anti-inflammatory and they reduce the plaque. And the plant-based proteins have a low amount of acid, so they're not toxic to kidneys. The plant-based phosphorus that everybody says, oh, you shouldn't be eating all those grains with all that phosphorus if you have kidney disease. It's not true. It turns out that the plant-based phosphorus, sure, it's there, but it's actually bound to the phytates in the plants, and so it ends up not being absorbed, as opposed to the animal-based phosphorus that you're then going to have to give the patient some Renagel and some phosphate binders. So then, and the potassium really shouldn't be a concern in people unless they're not on dialysis yet. But for people who have end-stage renal disease, you would just dialyze it off. So I do want to get back to the issue of COVID illness and the microbiome, because the data is very clear that we should have had the guts to go vegan very early on. We had data early on saying that our cardiovascular risk factors were related to COVID-19 severity and lethality. And it's cholesterol, it's hypertension, it's obesity. And if you could take them, all of the risk factors that are modifiable and lower them, lessen them, which you can do with a whole food plant-based diet, you're going to lower the risk of having a severe outcome from COVID-19. So we now have the data from Sarah Seidelman's group that's talking specifically about that. She put this together with combining data from healthcare workers in 6 different countries. And it was very clear that the more plant-based you were, the less likely you were to actually get sick. And it turns out that it cuts the rate of moderate to severe illness if you're plant-based by about 73%. One of the things that we were fighting before COVID were people talking about keto diet because it is highly successful at lowering weight. And the more animal products and, particularly red meat, low carbohydrate, keto diet, more fat, more bacon was actually successful at lowering diabetes, blood sugar, lowering weight, lowering blood pressure. It killed a lot of people because of the increase in the cholesterol and the inflammation. But people, at least doing it for a short period of time, maybe they would get away with it. Not something I ever recommended because of the cardiovascular risk. But the bottom line was that when you look at what happens with COVID and why, you know why. It's because of the microbiome when you're eating deceased carcasses. And so what ended up with the keto people was a dramatic increase in moderate to severe illness when you were eating that type of animal-laden diet. Now, I do want to just mention, since I talked about Sarah Seidelman, just mention that the keto diet had problems before. If you're doing it with all of the animal products, you had a higher mortality. If you were doing it with plants, you had a lower mortality. And that makes perfect sense in terms of inflammatory markers, and that 18% reduction if you're doing a plant-based keto diet was actually great. She actually showed that the more keto you are, the more low carb you are, the higher the mortality. And this was a great graph because it's explained about the 5 other studies, and some of them said it was 20%, some said it was a 70% increase. It just depended on how keto you were and how risky your population was. Now, going back to COVID-19 for a moment and the microbiome, this is the clear connection between diet and COVID-19. It explains Sarah Seidelman's data. That is, if you have the animal products in your GI tract, you will have the dysfunctional immune system because of the bacteria that are there that make you have a bad outcome with COVID-19. And that includes the so-called cytokine storm that everybody's heard about. This doesn't happen when you have a good microbiome. So, can we intervene and make the microbiome better? You know we can, because the TMAO levels drop. So you know that over a matter of just a couple of weeks, you certainly can change the type of bacteria that are present and accounted for in the GI tract. And you can make a much more supportive immune system out of the human gut microbiome. So this is probably the best summary that I've seen. It's such a complex looking slide because it includes a lot of mechanisms, but ignore the mechanisms for a moment and just think about the fact that what you eat determines the bacteria in your GI tract, and that determines everything from how you deal with immune crises to what happens to your blood vessels. And every cardiovascular risk factor is dependent on what's happening in your GI tract. So before we actually had all this microbiome data, we had already come out. I mentioned that the American Heart Association did change its guidelines. I was happy to be on that committee and, and fight with the people. It's great being on a guideline committee. You bring all your data, you write your section, but you drop your ego at the door because they're going to beat you up. And if every study isn't nipped and tucked, it's going to get thrown out of the room. But going through all of that, we ended up with, I think, is some pretty reasonable guidelines. Is it perfect? No, I think that we could do our data better and make it perfect. For example, class 1 recommendation, meaning this is something that everybody should be doing, is a diet that emphasizes vegetables, fruits, nuts, beans, whole grains. How did fish swim into the guidelines? again, it was that substitutionary benefit I talked about before, that, and people would do better, particularly with stroke, if you got rid of the red meat and went toward fish instead. But for optimum human health, you would get rid of all of the animal products. Replacement of saturated fat with plant-based fats, which tend to be more monounsaturated and polyunsaturated, reducing cholesterol and sodium, getting rid of processed meats, refined carbohydrates, and sweetened beverages. And so these last two are really important for our because I know there's so many people in your organization who are concerned about the environment and animal rights. And we tend, in that group of our vegan population, tend to eat things that are fun, like vegan beignets and vegan donuts and ice cream, and drinking fruit juices, doing a lot of juicing where the fiber goes into the garbage and the juice goes down the stomach. Well, it turns out that these are all issues that increase mortality. And there's data from the publication Journal of American College of Cardiology 2017 showing that an unhealthy plant-based diet, that is taking a vegetable and frying it, doing refined grains, sweetened beverages, it turns out that that diet is actually worse for you than eating animals. And this is something that the keto people have been talking about for years, that the vegan diet isn't healthy. And there's data saying that vegan diet doesn't improve outcomes. Well, it's an unhealthy vegan diet that doesn't improve the outcomes. We don't worry so much about trans fats in this country anymore. We got them legislated out a couple of years ago. Okay, so it's great to make guidelines, but the question is, who's going to implement them and who's going to pay attention to them? And I want to talk about that a little bit because I need your help. We all do. As a healthcare system, we need a lot more help in getting this data out here. And so I'm going to talk a little bit about the nutrition intervention that we did on the south side of Chicago. That's why you see my logo went back from University of Louisville to Rush, where I was chief of cardiology until 2 months ago. And yeah, on the south side of Chicago, we were able to intervene in Trinity Church of God in Christ, which is President Obama's old church. And what we're able to do is find people who are interested in actually changing their diet. They did it over Lent for 5 weeks. And we were able to actually deliver whole food plant-based diet, 3 meals a day for 5 weeks to 53 patients or people, volunteers. And we measured everything that you could imagine. And the changes that we saw were absolutely dramatic. You could see a drop in the TMAO level, a drop in the insulin level, cholesterol, inflammation, you name it, it got better. And this was a very much at-risk population. There was a lot of obesity, a lot of hypertension. A lot of people were coming off of their blood pressure medicines because their blood pressure was getting too low on the vegan diet plus pills. The completion rate was higher than we expected at 88%. And adherence, meaning that out of those 44 people, when we said, how many times did you deviate? How many times did you eat something else? And they were pretty adherent, not completely, but 93% was pretty good. They lost a lot of weight. And they had a marked improvement in a lot of the cardiovascular risk factors I mentioned. But we can plug those risk factors into our ASCVD risk calculator. If you don't have that for your phone, you really should have it. We go into the community, the HEART program, helping everyone assess risk today. That's what we do. We use an iPhone app. And we were able to eliminate 19% of that 21% increase that we know we have for cardiovascular mortality in African Americans. We have a cookbook based on the ACC recommendations. It's from the Association of Black Cardiologists. If you Google it, Heart and Soul Cookbook, you can find that PDF and share it with your friends and family. So yeah, big study, great publication. We made the news, but the question is, did we make a difference? And that's where I need your help, because we need everyone to know that you can reduce risk with a plant-based diet. And we need to talk about it incessantly because it's not getting very far. We actually did a recent study right before I left Rush a couple months ago. How many of our doctors were following the guidelines? We were looking for how many vegans and the initial trial was to see when they got COVID, because so many of us ended up with COVID, being healthcare workers. Question is, how bad were people? How did they get sick with their vaccines? And the answer was, whoa, we couldn't do that study. Why? Because the number of people who were plant-based or even pesco-vegetarian, that is, those are the two groups that would follow the ACC-AHA guidelines that we published 3 years ago. It turns out that the vast majority of the doctors are eating all of the terrible things that we telling our patients that we shouldn't. And so out of 274 doctors, we had 11 who would optimize their diet. So we really do need a lot of internal and external evangelism, if I can call it that. I don't want to disgust anybody who's looking at these slides, but I had to take a picture and I'm just sharing it. I mentioned being at the American Society of Preventive Cardiology a couple weeks ago in Louisville, and this is what they were serving to the doctors. And, you know, I can complain about it, but ultimately we have to change the culture. We have to change the educational status. And it starts with physicians and healthcare workers. And hopefully everyone in the sound of my voice will do something about it. So closing up, I just wanted to summarize that, you know, that we have a lot of issues with healthcare financing, health inequities, ethnic disparities. A lot of it is diet. The vast majority of it is diet. And the diseases that we're facing and are mediated by the risk conferred by the microbiome. And if we switch to plant-based diet, you're going to see a massive number of cardiovascular risk factors and cardiovascular diseases just melt away. Now is the time to do this, because in our dual pandemic, we really should be trying to reduce all of these risk factors to reduce the mortality associated with both parts of our pandemic, both the cardiovascular disease and COVID-19. As you know, like what everyone is saying about BA5, you could have had a vaccine 2 weeks ago. You could have had, you know, COVID last month. BA5 don't care. It's going to come after you anyway. So let's improve the microbiome. Okay, so I would say, you know, and that really was my final slide. I just want to, you know, just put out there, put a quote out there for people to remember. Aging is inevitable, but getting old and getting chronically diseased, that's definitely an option. Lifestyle is key. And so please, you're making a choice every day, every meal, and every mile that you get out and run. All right, I will stop right there. Actually, I'm looking at my clock. I think I have a few more minutes before. So let me just do one more minute. That's not really in the lecture. Just a couple more slides to talk about. I usually do this in a live audience. I ask people, what's the mortality rate for beef consumption? Anybody want to turn on their mic and tell me?
Is it 90%?
Close. It's 100%. Where am I getting that? Uh-oh. Okay, so I had to throw a little animal rights in here. And if we just thought about the sentient beings, it would help human health tremendously. And, you know, to be honest, now that I have 9 grandkids, I am concerned about the planet, probably more than I was, you know, a few years ago. For me, it was all about healthcare. Now I understand the issues of animal rights, and I really understand planetary sustainability. And I would just like everybody to know that, you know, if you're driving a hybrid car and then eating a steak, you're just not thinking it through, because the biochemistry is actually pretty clear. Carbon dioxide is 23 times less difficult for the environment than methane. So please, let's spread the word. Okay, and if with that, I leave the last few minutes open for questions.
Wow, thanks so much, Dr. Tim Williams. And yes, I imagine there are a number of people who have some questions.
COVID was so inflammatory and so vascular toxic that we did see a lot of heart attacks, particularly in the COVID population. But we also saw the COVID, you know, you heard of the freshman 15? Well, it was the COVID 20. Yeah, that is, people were gaining weight because they were staying at home and they were quarantined. We also saw rates of alcoholism go up. And if, you know, I won't mention which name in the Chicago area, Benny's, those people made a massive amount of money because of people drinking so much. And so this was, so anyway, it wasn't so good, and also people were exercising. They were closing tennis courts. Now, why would you, the person is 78 feet away. Why would you close off a tennis court? Some of it didn't make sense, but a lot of what you say is actually true. And I can tell you, and I hope it's not too long an answer, but everyone needs to know that the Biden administration did decide to go ahead and do a conference on nutrition, health, and hunger. And I'm one of the committee members to try to make recommendations. I put out there some recommendations that I thought nobody's going to listen to, like we need to do food labels, red, yellow, and green. Is it healthy? Is it not healthy? Similar to what you're saying, that we should be doing food subsidies for healthy things like Finland did to drop their cardiovascular rate. We should not. We should stop doing food subsidies for Congress for things like high fructose corn syrup and refined grains. And these are. And I also think, based on the data that we collected at Rush, that people should not be allowed to market, because we don't market cigarettes. It's not since 1973. But we market meat and fast food that increases mortality. These are the things that we really could make a difference with legislation and regulation. And so, we'll see, how many of our recommendations are actually accepted. Change the SNAP program around so that if the government is paying for it, they're paying you for healthy food and less for unhealthy food. I'm sorry, I see in the chat, what did Finland do? Finland changed from dairies to berries in terms of what the government was subsidizing, and they saw a dramatic drop in cardiovascular mortality. The whole world got turned up on its head with the publication of the ischemia trial, ISCHEMIA, if people want to look at it. And that changed our American College of Cardiology, American Heart Association guidelines. It's only been December. So it's hard to take a ship that's been going in one direction since Andreas Grunzig came to the United States with a balloon in 1980. But the fact of the matter is, the vast majority of the bypass surgery and the stents that are put in, vast majority are not necessary. People have been saying that for years, but now there's trials and now there's guidelines saying that if you're not having a heart attack, if you're stable, and if you have left main disease, that is the artery that gives off the one in the front, the so-called widowmaker, and the circumflex. If you're not having left main disease, you really should not be having any intervention other than diet, exercise, medication. And so that's hard for cardiac surgeons and interventional cardiologists to swallow that. But it is our new guidelines, and I'm anticipating that, given another 18 months since publication, so maybe, end of next year, I imagine that the payers are going to follow that as well and say, thank you very much for that stent. We're not paying for it because there's no evidence that it improves the outcome of the patient. That is really hard to hear because we're so ingrained into, we want to treat it, we want to make it better. Despite the fact that everything we were doing in that regard was mopping up the floor instead of turning off the faucet. We put in the stent, we do the bypass surgery, and as soon as the person's extubated or they're waking up the next morning and they're being fed bacon and eggs by the hospital. And so all of that needs to change, hospital food and cardiovascular practice.
Yeah. I have another question about something I heard you say at one of the conferences about bad cholesterol and good cholesterol. Didn't you say that that good cholesterol is not really good cholesterol anymore?
Not at all. I mean, so the only part of that we had right is that if your HDL, or high density lipoprotein cholesterol, is very low, it does increase your risk. And there is some function where it does reverse cholesterol transport, but there's a limit. If it's normal, that's good. If it's low, it's bad. And if it's high, it's bad. And anyone can just take your search engine, Google or whatever, and type in the word HDL mortality, and you'll see these U-shaped curves pop up, where what we used to tell people, oh, your HDL is really high, you're cardiac immortal. Completely not true. It actually increased heart attack rates.
Thank you for that. That's much appreciated.
if people are doing a whole food plant-based diet, they're going to get the right amount of protein versus carbohydrate. The issue is when people are worrying about those percentages, they're talking about trying to optimize how much refined grains you're getting, refined carbohydrates. Those are dangerous. Nobody should be doing them. And when you're, so the way things grow on a tree or in a field, that has the optimum ratio of complex carbohydrates and protein. So I wouldn't even think about that one. And I don't think there's been an answer anyway about which is best. I certainly wouldn't believe this business from keto for the reasons that I talked about. We'll see a lot of retrenchment of people who used to say no oil because the benefits of monounsaturated oil and polyunsaturated oil are so strong. They actually, if you're not, I mean, no one's taking, and drinking an entire bottle or anything like that. But it's saturated fat that hurts blood vessels and increases cholesterol. But if you're talking about oils that are used in the context of a whole food plant-based diet, you're really not hurting yourself. Probably the best example of a whole food plant-based oil would actually be avocados. And if you put that in your search engine and you put LDL, avocado, or put in avocado mortality, you're going to see two studies, very large, peer-reviewed recently, showing that you dramatically improve cholesterol and you dramatically decrease death rate by using avocados, despite the fact that there's so much monounsaturated fat. So all of that stuff, all the people who were saying that, there not alone. Greatest example is that HDL stuff. We told people for 60 years that high HDL was good for you. Fact of the matter is medical knowledge doubles every 73 days. And we have to be willing to change pretty much everything we said. I talked about aspirin, how we don't do that anymore. There's so many things or bypass surgery, stenting. We just have to get better and better and stay up with the literature.
How much time do you have to see patients, and also is there a particular kind of heart surgery you still do, or?
So first of all, I never was doing heart surgery. I was more like the cardiac. So cardiology versus cardiac surgery, they're two completely different things.
Okay.
They overlap a little bit in the structural area, and they hopefully sometimes work together. But I actually was a non-invasive cardiologist doing nuclear cardiology. So I was basically a radioactive photographer. That is, I would do this type of testing and do it well enough to be able to tell people if they needed bypass surgery, if they needed a stent or that sort of thing. Do they have heart disease?
Thank you very much to Dr. Kim Williams for sharing with us today your riveting and wonderful information, the exposition of the results of so many well-researched, peer-reviewed studies. I hope they convince a lot of people to go plant-based. The difference between what happens with an unprocessed plant-based diet compared to based on animal protein, pretty amazing. Its effect on human health, mortality, your microbiome. Thank you so much. We've learned a lot today, I think.
All right.
And we'll
Thank you. Thank you for having me.